It's not just about the technique, your skills in the surgery that determines whether a transplant is good or bad. Candidate selection is also super important. You could be the best surgeon in your technique, in your planning, in your design and everything. But the wrong candidate could really mess everything up. And what do I mean by wrong candidate? Well, there are many things that can come into play. For instance, a patient who has unrealistic expectations. If you believe you're, say, 25 years old, your hairline is receding, and now you just want to get back your original hairline because that just looked so really nice on you, and that would just restore your confidence. Well, that could be the case, and the patient, it's very understandable that the patient wants to have their hairline restored. Makes good sense. But the thing is, hair loss is a dynamic process. You're going to lose more hair, and as you lose more hair, you might regret that you had your original hairline restored. So also patients that might just be looking for a solution for their problem as of today, they do not take, if they then do not take the dynamics of hair loss into account, then they could be in trouble. It could be patient selection in terms of, so how well is your donor area? Your donor area may look fine today, but depending on the speed that you're losing hair with, depending on your expectations, depending on your actual donor area, and depending on whether your hair is thick, your hair is thin, the results will vary greatly. The results you will have today, the results you will have in 10 to 20 years from now, with that same hair transplant will vary as you lose more hair. If you have thinner hair, the relative results from the surgery will be less even with the same number of grafts. And then the wrong patient could also be if they're looking for having the wrong transplant. Say a patient who is struggling with hair loss in the crown, and otherwise they're looking quite okay. Say the patient is 30 years old. So this 30-year-old with some hair loss in the crown will obviously focus primarily on the crown. It makes good sense. You just realized from some pictures, or you went to in a bathroom and you saw that the mirror arrangements, oh, my hair is falling and I have a bald patch in my crown. That it can be quite dramatic, the experience, and I've seen it myself when I saw my crown the first time. I was kind of shocked. Is that how I look from the back? But the thing is, you're going to lose more hair again. So if you were to transplant to your crown and to do what you want and what you need for exactly today, well, then we would be using, say, 1,000 grafts. But 10 years from now, your crown might have expanded and you might need another 2,000 or 3,000 grafts for reasonable density. But compare that to a patient who has exactly the same hair loss, who is now not 30 years old, but 55 years old. Well, that totally changes the scenario. So it took the patient 55 years to reach that hair loss, to get that crown, the bald patch in the crown. So it looks like a very slow process. Chances are he may not have much more hair loss. And if he even has more hair loss, it might be very slow hair loss. Everything indicates that. In that case, with exactly the same hair loss, with exactly the same recipient area, with exactly the same kind of hair, thickness, color, contrast, everything considered, well, the 55-year-old, I'll tell him to come and have the transplant. And we expect him to be happy, not just a year, 2 years from the surgery, but 10, 15, 20 years down the road. So selecting the right patient is really important. We need to look at patient expectations. Are they realistic? Are they realistic for today? Are they realistic for 5, 10, 20 years from now? Are they realistic in terms of the design, number of grafts we have available, and the fullness that we'll get with those grafts? You could have the same number of grafts, but with thinner hairs, or the contrast between the skin and the hair is greater. The impression of density would be far less. compared to someone where the contrast between hair and skin is less? What do we expect the patient, the hair loss to be in the future? How extensive hair loss will the patient have? And what will be the likely permanent zone, the actual permanent zone? We might make a misinterpretation on a patient if we think that whatever he has today on the sides and the back of the head will last him for the rest of his life. We could very well be wrong. When I had my very first surgery, some of the grafts that I went to another clinic, a friend of mine, and some of the grafts that were taken were actually taken from the non-permanent zone. And as my hair loss progressed in the crown, my crown got bigger, further, the border of the crown went further down. I actually lost more and more hair from my recipient area because it was taken from the non-permanent zone. And keep in mind, at that time, I was 41 years old when I had my first transplant. So this is not some theoretical considerations. Maybe we should take it into account. Maybe it's not that important. And what about just doing what we have to do right now and that's enough? That's not how it works. These are really real considerations and have to be taken into account. So patient expectations, patient's present hair loss, and the estimated or the assessed future hair loss, the patient's donor area, the contrast between the hair and the skin, and the thickness of the hair. All of these things do really matter when we want to assess what is the results that we expect now, 5, 10, 20 years down the road. So have a thorough conversation with your surgeon. Don't just settle with, oh, you have a fantastic donor area. Yes, of course, most people in their 20s, 30s will have a fantastic donor area. But maybe we haven't taken into account the future hair loss. Maybe we are not maybe you're looking at some of the non-permanent zone and bringing that into the donor area. And is that a wise thing? Maybe it's not. So make sure whenever you speak to a doctor that you really have a deep conversation. My hair loss consultations are often around 1 hour long. And there's a reason for that. It's not because I couldn't assess the patient. That would take me maybe 1.5, 2 minutes to do the assessment. What we need to do we need to investigate the root causes? Do we need to start symptomatic treatment? Do we need to do a hair transplant, or do we need to do a combination of these three things? So the issue is not for me. The reason the consultation takes that long is not really because I have a problem assessing the patient. My major concern is making sure that what the patient expects is what we can get. And if we cannot get what the patient expects now and in the future, then we need to have a proper conversation about it so that the patient's expectations are more realistic, aligned with the possibilities that the patient has, with the donor area, with the hair characteristics, with the present and likely future hair loss. All these things need to be discussed properly. I hope that gave you some insight into why I have these long consultations and what's the benefit of having this longer assessment and conversation with your surgeon. Thank you for watching and see you in the next video. हाँ कोई बात नहीं, ये स्टैंडर्ड लोन है.